You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Kornfeld, thanks for coming over.
My pleasure. I'm glad to be here.
How's New York?
It's getting cold, but it's a great place to live. I love it here.
Yes. Um, you're you're someone who has a lot of experience in your field. Can you give the listeners a little bit of summarize of your past performance, I would say? How did you start and where are you now?
Well, I started in podiatric medicine and surgery. I did conventional residency training. I came out into the field looking to, basically do as much surgery as I could because I thought that was the answer to all of these foot and ankle problems. And one of the things that happened to me along the way was I got really busy really fast. I had no business training whatsoever. I was completely overwhelmed. I didn't know what I was doing. I kept hiring people. I kept having to see more patients. I kept needing bigger offices. It was like a runaway train, actually. And before anybody ever identified what it was, I started getting multi-system symptoms. And I just didn't know what was happening to me. We now know it's called burnout, but
Yeah.
I didn't know what was going on then. And I started seeing a bunch of different docs. I was getting medications for all the different symptoms. Nothing was really working. One of my friends said, "Why don't you go to a holistic doctor?" And I said, "Holistic doctor? They're all quacks." I didn't know anything about it at that time. This was in the mid 80s. Okay. But out of desperation and after suffering for 3 years, I went to this doctor. He gave me an hour and a half intake, which was nothing that I ever expected. He was incredibly precise in asking me questions, going through the review of systems. And then he started talking to me about my personal life and the way I felt about my practice and what was going on. And it just went on and on until the point where he said, "I think I know what's going on, and this is what we're going to do." And he changed my diet completely. He had me start exercising more regularly. I wasn't well hydrated because I had no time. I was running from treatment room to treatment room. Long story short, within 3 months, I felt like a different person. And I said, "This is what I want to learn." And I dove in. Whatever course, whatever seminar, whatever organization I could join to learn more about holistic approaches to healing and keeping healthy. And then I started applying it into my practice. And I was astounded at what was going on, completely blown away. Patients who were scheduled for surgery never made it to the operating room because they healed. So it just re-inspired me completely. And I went that path. And eventually I got to the point where I was getting all of these issues with insurance companies. We don't pay for this, we don't pay for that. You can only use drugs and surgery. We don't pay for prevention. We don't pay for anything natural. We don't pay for anything holistic. So, and I was back up to about 55, 60 patients a day as a solo practitioner. I was killing myself and I was heading back into burnout, not because I didn't know what it was. I just couldn't help it. And I decided at that point, my health is more important right now because if I'm not healthy, how can I take care of my patients? If I'm not present and centered, they're not going to get the best of me. And how could they? They all had a visit of a few minutes. And I ran and ran and ran. I quit the insurance dependency game. And I decided I have a niche. I knew functional medicine very, very well. I had just at that point started doing regenerative medicine about a year or two before. And I thought, this is what I want to do. And if people are willing to pay me, this is what I'm going to do. If they're not, I'll go back into music, which was my first love. So, of course, it comes down to promoting yourself and marketing. And when you start something of this type, all your fears come up. A lot of negativity was coming into my head. My brain was trying to talk me out of everything that I wanted to do. And I said to myself, what am I protecting myself from? If I protect myself from failure, I'm also eliminating the option of success. So I said, I'm going to push through every fear I have. I don't care that they're there. I'm going to do what I have to do. And I started educating the public. I developed a radio program. I was doing a lot of public speaking. I was writing a lot of articles in local magazines and journals. And little by little, in that aspect of the marketing, I was educating myself more and more and more about what people want, what people need, what they're looking for. And what was amazing to me is that there were thousands of people out there that were failed by the system. that the cortisone shots and the NSAIDs and the analgesics and the physical therapy and all the surgeries were not solving the problem because no one was looking at the underlying mechanisms. No one was bothering to find out why they crossed the morbidity threshold in the first place. So that aspect of medicine has just been an absolute joy and pleasure for me. And I ran a very successful practice for the past 25 years. Although now at age 71, I'm slowing down tremendously. But on 8 to 10 patients a day, I had a better income. I was a better doctor. My outcomes were far superior to what I had when I was running from room to room, dealing with the drug and surgery mentality. And I really feel like I've helped so many people who weren't helped by so many other doctors. So because I love it, it fed my success. Because I really enjoy what I do, I try to teach it to my colleagues in podiatry. And for a couple of years in the early 2000s, they were letting me, lecture in places. And then all of a sudden, it kind of got harder for me to lecture. And all of a sudden, no one was responding. And I realized I had been ostracized. And rather than force it on them, I walked away because I had lots of, compatriots in the world of functional medicine, albeit none of them podiatrists, but it didn't matter to me. We all teach each other. We all bounce off of each other. But in 2022, and I don't know what happened in 2022 because I had been out of the insurance game for so long, I received 111 emails, 111 from podiatrists who were in burnout, who hated their life, who had spent so many decades in practice and had nothing to show for it. Everybody was asking for help. So I sat down with myself. It took me about almost 7 months. I created a course. I founded the Institute for Functional Podiatric Medicine. And I am now teaching the podiatrists who are interested in learning how to be healers instead of being providers. And I don't say that lightly because providing a service is not healing. When an insurance company says you could do A, B, but you can't do C, D, E, F, G, are you really a healer or are you just a cog in the wheel? It's the whole system is bad.
Yeah, you brought up several issues here that I want to kind of dissect a little bit.
Okay.
First of all, you said something very interesting and important, I would say, the fact that you became successful because you failed. And I want to give an example, if you have, of anything in your practice that failed you or the practice that kind of, propulsed you to a different level of success.
Well, you're talking about since my change toward a more functional
Yeah.
medicine model? Okay. Um, well, one of the things that I thought I needed to do was help patients with their epigenetics, diet, lifestyle, and environment. So because I had the time, I wasn't seeing 50, 60 patients a day. I got myself educated in nutrition. And I would sit with patients and teach them about diet. And I would spend time with them, educating them on what's a healthy diet, what's not a healthy diet, how do we eat, and what sequence do we eat, and why we don't eat the same foods over and over and over again, etc. I found it to be an incredible waste of time. Why? Because patients are loath to change their diet unless something life-threatening is happening. It's difficult. So instead of following that path and continuing to spend time getting nowhere, I just studied the sequence of how the human body works, what nutrients it needs at different times of the day, and I came up with something called the metabolic reset diet. I'm not going to say that it's patient specific, but it's easy for them to implement and follow, and most of my patients do it. And I don't sit and waste all of that time because that whole part of what I was trying to accomplish, I'll consider a failure because it was a time waster for me and it didn't really move the needle for patients. There are other mistakes I made along the way.
Yeah.
And that's fine. I lost my fear of failure because I realized that the more things I do, I'll eventually find what works. So I honestly didn't see things as a failure. I saw it as an educational process that
Hmm.
it didn't work. Okay, what else can I do? This didn't work. What's another option? I never beat myself up about it. I just kept pushing through, looking for more ways to educate myself so that I can parlay that into something that would benefit my patients. And it's been an interesting journey,
Yeah.
that's for sure.
Another thing that's interesting to me is the fact that podiatry is a field that people don't necessarily understand, I would say, from the functional body point of view. And I would invite everybody to think about what would they do if they cannot walk. It's a scary thought. So from that perspective, when you started to develop the Functional Podiatric Institute,
Hmm.
how would you change the mind of your podiatry colleagues who are clearly a bunch of medical professionals that are trained for procedure-based reimbursements, I would say.
Right.
And
Well,
you
one
have to change their mindset to a functional medicine point of view in podiatry that doesn't necessarily click from the first thing.
no, it doesn't. And unfortunately, podiatry residencies are 100% surgical.
Yeah.
There's really no medical management. You rotate through different departments, but you're really focusing on your scalpel more than
Yeah.
anything and your technical skills. I think what's happened over the course of the past 15 or so years, much to the chagrin of podiatrists and probably orthopedic surgeons too, is a lot of the surgical fees are so incredibly low that it becomes a very frustrating experience. And because they're looking for ways to augment their income, to find ways to have it easier at the end of the month, paying their bills and saving some money, they've looked outside of surgery for answers. The number one, I think, right now is regenerative medicine.
Hmm.
They're looking at stem cell derivatives and peptides and all the things that are gaining traction. And I don't fault that at all. Regenerative medicine to me is incredibly powerful. But I explained to them that if you want to do the things that require an efficient immune system that are going to speak to stem cells, that are going to communicate with messenger RNA, you need an unburdened immune system. That's where functional medicine comes in. When we understand why there's immune burdens, why there's immunosenescence, why things are going bad, then we can start correcting things that we're capable of correcting. Even genetically, there are so many things we can do to override, genetic variations and mutations once we understand how the human body works. One of the things I discovered that was shocking to me is that a great majority of patients in chronic pain, and by the way, that's basically what I focus on is chronic foot and ankle pain patients, they're dehydrated.
Hmm.
And I'll ask them, are you ever thirsty? No, not really. Oh, how much water do you drink? I don't know, 2 glasses of water. Well, that's clinical dehydration. Body's not asking for water because it's not expecting it. It figures out other ways to pull it out of your cells. Quickest way to shorten your telomeres. Quickest way to head toward a premature aging. So I think they get it. I think they understand that part of it. The thrust of my course is introducing them to the new concept of healthcare rather than symptom management, which I think every doctor really needs to learn. How we put that into a insurance model, I have no idea. I'm not concerned with it at this point because it didn't work for me then, and it probably wouldn't work for me now. But if insurance companies were smart, they would think about things in terms of health promotion rather than waiting for people to fall apart and then manage symptoms till the day they die. It makes no sense to me. Um,
Yeah, from the business point of view, what I'm thinking is that, the insurance companies reimburse your services, your procedural services, mainly because it's a surgical procedure. But
right.
the concept of evidence-based medicine, um, it's clearly after a surgical procedure, but how do you convince them that patients get better from a holistic approach, from a functional medicine approach? I think that's the battle that we need to take with the insurance companies.
I agree. I think it's intuitive if you sit and have a conversation with someone
Yeah.
and you ask them, what do you think would promote better health? A diet high in refined carbohydrates and fast food, or an organic diet with healthy amounts of vegetables and good amounts of, variation in food source, free range, cage free, all of the things. And they're all going to say, oh, definitely, that's a healthier diet than fast food in this. Well, if that's the case, if you're aware of that, and you have a patient coming into you that has chronic foot pain, chronic ankle pain, and 5 other comorbidities, and they're on 6 medications, if you want to get that foot and ankle better, you have to do something to help that immune system respond. So, and the biggest problem with foot and ankle pathology, it's the furthest place from the heart. It's the worst perfused area of the entire body. It goes through all kinds of premature, degenerative changes way before the rest of the body does, if nothing is done to combat that. Certainly dehydration, because as soon as you lose blood volume, it's not going to the foot, right? It's going to go other places that the body has to triage to. So I think in those conversations, they start to open their eyes, they start to get it. The docs that have taken my course are definitely re-inspired in a way that they never felt before. It's one thing, it's exciting to go into the operating room and fix things, but it's really a technical skill.
Yeah.
You're not changing the underlying mechanisms. You're not talking to the patient in a way that's going to help them going forward. They just have a corrective procedure. They feel better until the next thing falls apart. So those conversations I have with doctors should be given to the insurance companies. I think it's penny wise, pound foolish to say, well, 100% of the patients could do better from this kind of medical management and prevention, but only 15 to 20% are involved in pathology care. So it's cheaper for us and better for our bottom line if we only do that and we don't actually prevent things. One of the things that, if you don't mind me saying, when patients are educated this way, they will walk into the supermarket and they will question what's on all the shelves. They will look at labels. They will want to know what's going on. If that happens and we educate the public, then all of the garbage that's being fed to us, that's leading us to go on to drugs for management, would end. People wouldn't buy it. This
Yeah.
is a supply and demand culture, right? If healthier food gets cheaper as the demand goes up, it would, right? More people could afford it. So I don't know the
Yeah.
answer as far as insurance companies go, but
Yeah, it's a terrible, issue to deal with, indeed. And I feel like in every specialty we have the same issues basically to deal with. The fact that patients need to be educated that even if they have one single organ or issue with a leg or a foot or a hand or an elbow, it doesn't necessarily need to be treated locally. It has that issue comes from a systemic problem in their body that need to be looked at. And like you said, start with what you're getting into your body first. And
absolutely,
then what
absolutely.
effects that does that have to your foot or the way
Mhm.
you're walking or your pain or something like that. Um, but it takes education and it takes time, and you don't have that time when you see 30, 40 patients a day.
No.
Um, so when you transition to this model of business, what was the hardest thing to wrap your head around?
The hardest thing to wrap my head around is that the phone wasn't ringing off the hook anymore. And, we have a tendency, at least in medicine, I don't know if in other fields, when you see a crowded waiting room, you think this doctor's a success,
Hmm.
right? A lot of people want to see him. He must be really good. When I first transitioned and the phone stopped ringing, because right away, probably 90% of my patients wouldn't come anymore. And I realized they weren't my patient avatar. They
Hmm.
came to me, maybe they liked me, maybe they didn't care. They came to me because I accepted their insurance. So when I stopped accepting their insurance, they were right on the mark to find a new doc. However, once I started marketing what I was actually wanting to do and educating people on my radio show and my lectures and my articles that I was putting out, I started attracting people who valued what I was offering. And that value, that time involved, that commitment to them has value to them.
Hmm.
So while I won't say my fees are astronomically high, they're high enough that everybody gets all of me. I don't have to crowd my office with lots of patients. And little by little, I started skimming my staff because I didn't need them. I moved into smaller and smaller offices over time. And the most amazing thing that I discovered in 2014, um, I decided I didn't want to work in a large office with staff anymore. I just wanted quiet, peaceful remainder of my practice. I fired my entire staff. I rent a room with a physician in Manhattan, and I rent a room in an office building in Long Island. It's just me, no staff. Every interaction with patients is me and the patient. Those have been the best 11 years I ever spent in practice. The doctor-patient bond grew much deeper, and as it grew deeper, I started getting more referrals from my happy patients. So I didn't have to run around marketing as much. Um, and it's just an interesting phenomenon to see how I became more successful emotionally, spiritually, not just financially, but it just improved my whole outlook on life. It helped me as a human being. And
Yeah.
of course, my whole existence has been trying to transform and evolve and grow out of whatever childhood baggage I had, because we all have it, right? All the negativity we have, all the fears we have, all the things that your brain tries to stop you from doing because it thinks you could fail. Um, it's such a waste of time. And although now I'm only in the office about 8 to 10 hours a week, I'm concentrating more on bestowing my experience on other doctors so I could feel like I could pay back, you know.
Yeah.
Um, and I think that's important to me,
Yeah.
especially
No.
now with so many doctors being depressed and overwhelmed and burnt out
Yes.
and unhappy.
it's a very big issue, and I think many people don't even realize where they are in their lives with this issue. They continue to, be in the rat race and go on with their daily lives, but um, they it's hard to make a change, and it's hard to visualize yourself in a different position, either from lack of mindset or inability to get out of comfort zone, take risks or take action. Like you said, in enterprises that can bring you to a happier place, like you are now. Um, but from your perspective right now, when you look back to a training podiatrist, what changes would you make in
Oh,
their educational system?
right off the bat, every college of podiatric medicine would have functional medicine and regenerative medicine being taught to the students. All the residencies, it would be there. Um, we used to have when I came out of school, your residency was part surgery, part medicine.
Hmm.
It's not that way anymore. That's a big mistake that I think was made along the way. So that would be the first thing I would want to do if I had the power to change things immediately. Bring that to the educational process in school and in training, so that when you become an attending, you have a different mentality, a different mindset. Um, I'm not saying that it's not a fun thing to do to go into the operating room and correct things, because I used to enjoy it too. But that's not all there is, and that's not what we're designed to do in the world of healthcare, is just fix what shows up. I don't remember the name of the game, but those little heads that pop up and you hit them with the hammer, and then another one pops up. That's what we're doing, and it's
Yeah,
unfortunate. You know,
yeah,
and not for nothing, but a lot of what goes on in the world of healthy natural medicine is interfered with by the FDA.
yes.
They don't like when doctors don't prescribe drugs. When we fall into something that works really well, the first thing they do is try to get it off the market or call it a new drug and you need studies, or whatever they've been doing with amniotic allografts and peptides. It's just ridiculous. Um, but they allow food on the shelves in the supermarket that kills people. You can take any drug you want that has the potential to kill you or cause 22 different side effects. That's okay. But the natural stuff, you know, I've been at it for so many years. I've never harmed a single individual. The worst that comes out of it is you get a patient that just doesn't follow through, doesn't comply, doesn't get the result you want. And okay, I did my best. I tried my best to counsel you. I tried my best to teach you what was important. But we're all adults. We all make choices. And if that's your choice, I respect it. I wish you well.
Yeah. No, it's very important to bring the mentality of a doctor that the main focus for us should be treating the patient and bringing the patient to a better state, not necessarily operating on them and doing a procedure on them. But from the insurance point of view, that's the most rewarding part, right?
Hmm.
From if you're on your side and you're doing a concierge, self-pay model, that brings the patient to you because they realize you are not doing things for them for reimbursement issues.
Right.
You're doing things for them because you want them to get better.
Well,
Um,
that's the whole key. And, when you do this and you're autonomous and you can make your own decisions about the care of your patients and you don't have a third party interfering in what you want to do, you can put together protocols that are patient specific,
yeah,
that do address each patient's individual needs. Because number one, you have time. Number two, you have the training and expertise. And number three, you have the commitment because you're not running from room to room. I could sit with them. I can listen. The greatest thing I got out of this whole thing was learning how to listen. I'm serious. I was in such a rush. I'm not going to say that no other doctor does this, but I certainly remember walking into a room, speaking to a patient, and within 30 seconds, I had a diagnosis in my head and I was moving in that direction.
yeah,
Once I started to sit and listen and spend 60 to 90 minutes with a new patient, it was a very different thing.
yeah,
I wasn't looking for the quick fix. I wanted to understand what was happening. And, one of the things that I came across in my career as a functional medicine doc, I've treated patients that have been operated on three, four, five, six times. I don't fault the first surgeon. I almost don't fault the second. The third one had to say, geez, failed twice. Why would I do it again? Maybe there's a reason why this patient isn't healing and repairing properly. We have to learn to look at things from a bigger bird's eye view, not just I'll do better than the last surgeon, or I'll do it a little bit differently and it'll work. It's why isn't this patient healing?
yeah,
And they're not healing for the same reason they came into you with the problem in the first place. What a lot of doctors don't know, even though they learned it in medical school, Chronic inflammation is necessary. It's protective. Without it, cells die much faster. So why are we giving them drugs to suppress chronic inflammation when that takes away the protection? Why are we interfering with the natural order when all we have to do is direct the body back to the primary pathways of inflammation that heal and repair? We need this education desperately. It's been so much a part of my reality every day. And I thought at some point in time things would change. They are, but it's changing in the public and it's demanded by the public faster than doctors are jumping on board.
Yeah.
And I think a lot of it is just fear. A lot of it is fear. Yeah. And,
Well,
and, and
and I think it's the fear of them switching the business models
right, right, right.
because we're creatures of habit, and I think most people are trained that way right now in medicine.
Well, I mean, you
So
can develop a hybrid model where there are non-covered services that you can look at. I mean,
yeah,
evaluation and management, even if it's functional medicine, that's part of an insurance, a reimbursement model. But there are a lot of things we do that are not covered. Um, but is it really succeeding? Is that whole insurance dependency model helping the public? I think every doctor has seen way more morbidity than they've ever seen, way
hmm
more comorbidities than they've ever seen. And probably what I notice in my patient population is the number one prescription is an SSRI. Everybody's stressed out. And if they're stressed out, that's the end of their immune system, right? It's just one thing's it's like dominoes. So we're doing things right, but we're doing things wrong.
yeah,
And I like to see that change while I'm still here on the planet. Well, I can say, thank God they got it now.
yeah. So with your experience and your wisdom right now, if you look back to your own self when you started, what kind of advice would you give to yourself?
Well, I would say don't let fear get in the way. That's number one. When I first transformed my practice and I started speaking about this with my patients more often, the first thing that happened to me was imposter syndrome. I said, I don't really know what I'm talking about. What if I sound stupid? What if I'm making a mistake? What if this? What if that? All those what ifs, throw them in the garbage, toss them away. I think what I definitely learned, and this is probably just because I studied a lot of neuroscience, our subconscious brain is pretty much programmed by the time we're 7 years old, right?
Yeah,
You're in a world of giant adults. They tell you what to do. They yell at you when you're bad. You get punished. You have to cooperate. Now we go into a field like medicine where you have to cooperate with what's expected. So we have these different things that trigger the same response subconsciously. But if we let those fears actually block us from what we really want, we've given the wheel of our car over to our 7-year-old self.
hmm
And I say, you know what? I'm an adult. I'm going to make adult decisions, which means I have to take chances. But one of the best things about changing in a world like we have today, there's so much support out there. You don't have to do things in a vacuum. You don't have
yeah,
to do things alone. I had a lot of doctors that I called upon that helped me and mentored me and, brought me up to speed in the things that I wanted to be good at. Um, and that's obviously what I'm trying to do. The course that I offer to the doctors is interactive, meaning they go home, it's all 8 modules, 29 videos. They watch it at their own pace, but they can email me with any question at any time. So there's a give and take and a back and forth. Because otherwise, it would just be another course. They'd finish the course, their fear would take over, and they move in. I do a lot of speaking to these doctors about moving past fear because they all have it. You know, I used to have it. So I know what it's like to let that keep you stuck. I know what it's like to let that keep you small, but it doesn't work in a world where you want to excel at what you have to offer.
yeah.
So, we make
How can they reach out to you and learn about more of your things
Well, they can
educationally?
find me on LinkedIn under Dr. Robert Kornfeld. They can email me at drrobertkornfeld@gmail.com. Those are the two easiest ways. Or they can go to my institute website, which is instituteforfunctionalpodiatric medicine.com.
So, Dr. Kornfeld, what's next
Well,
for
what's
you?
next for me is just waking up every morning. As I said, I'm 71 years old. Actually, tomorrow's my birthday.
Happy birthday.
Thank you. And every day I wake up and I say, today I'm going to have fun. Otherwise, it's another day that I could waste. So, my whole raison d'etre right now is doing things that I love, having fun. I'm a very, very committed songwriter. I write songs as much as I possibly can. I have my music all over the streaming music channels, brings me a huge amount of joy, especially when
Awesome.
people listen and tell me that they love my music. It's a way to share my deeper self with the world. Because when you write a song, a lot of your own personal experience comes out in your lyrics. So I'm trying to get my songs out there too. So that's kind of next on my list now that I'm not
Awesome.
working so much anymore.
Very nice. I'm hoping everybody will reach out to you for some wisdom of yours and try to get, you know, to see the world in a different perspective like you do right now.
Well, I
Thank you
think
so much.
happiness for me was a choice, you know.
Exactly.
Yeah.
Exactly. Thank you so much. It's been a pleasure, and hopefully, you know, you get to change a lot of people.
I hope so. And thank you for having me on. It was a pleasure.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Franku. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.